Good morning, everyone. Thank you for taking the time to join today's webinar presentation, Research Findings, the Impact of Mental Health Simulations on 18,000 Elementary School Teachers. My name is Maria Noesi, and I will be your moderator. Before we dive in, I'd like to go over a few housekeeping items. First, the presentation will be recorded. A copy of the recording and the slides will be sent to you after the presentation, so don't worry about taking notes. Attendees are in listen-only mode. However, we want this to be a very engaging conversation, so please use the interface on the right-hand side of your screen to submit questions, and we will have time at the end to answer all of them. Finally, for those of you on social media, please make sure to connect with us via Twitter. Our Twitter handle is @Kognito, and you can use the hashtag #KognitoWebinars. For those of you who are not familiar with Kognito, Kognito is a health simulation company based out of New York City that believes in the power of conversation to inspire, inform, impact how people think and act, evoke empathy, and change lives. Over the years, we've partnered with behavioral health and education agencies to rapidly build the capacity of K-12 school staff and high school students to lead real conversations that support school climate, student wellness, and academic performance. Our growing portfolio of simulations for K-12 professional learning and student curriculum cover topics around mental health, suicide prevention, bullying, and trauma. We also have additional programs in higher education for faculty, staff, and students, for healthcare professionals, military veterans, and consumers. Now, I'd like to introduce our presenters, who are the co-author of the article that has been published in the Journal of School Health. First is Michael Long, who is an assistant professor in the Department of Prevention and Community Health at the Milken Institute School of Public Health at the George Washington University. Dr. Long conducts research at the intersection of epidemiology and quantitative policy analysis with the goal of identifying cost-effective and politically feasible policy solutions to promote community health. He has over a decade of experience evaluating school health promotion efforts, including an ongoing mental health intervention in elementary schools. We're also joined by Dr. Glenn Albright. Dr. Albright is a director of research at Kognito, and he leads a team of researchers in evaluating the efficacy of its immersive learning and assessment role-play simulations to bring about sustained behavior changes in the areas of social, emotional, and physical health. I'd like now to pass it over to Dr. Albright, who will kick off this webinar presentation.
Thank you, Maria, and good morning, everyone. So the simulation that we're going to be talking about today involves placing a user in a virtual environment where they're going to have a conversation with a virtual human that's coded with emotions, memory, and personality, and will respond like a real person. The environment is set to resemble the actual environment that you'll practice these conversations, so it will be within a school environment. So the situational type of learning is maximized. It's set up so the learner can choose from different conversation tactics that you see on the left here. These conversation tactics are all the right things and the wrong things to say as determined by subject matter experts and end users. The idea is to create a safe environment where you're free to make mistakes and learn from them. So as you progress through the simulation, you'll become better and better at employing evidence-based communication strategies such as motivational interviewing and more experience at demonstrating empathy and emotional regulation. So the environment is safe, it's risk-free, the learning is often scaffolded where you learn certain basic skills in one conversation that will be built on and requiring you more advanced skills as you progress. That coupled with ongoing feedback. This feedback is available on several modalities, as you'll see, ranging from the virtual human's verbal and nonverbal responses to a coach coming out to a feedback bar that indicates the amount of engagement based on your communication strategies. That combined with a high fidelity of the training, fidelity in this case refers to the training being repeatable. Although each individual can have a very different response, these responses are repeatable because they're computer-based. The instructor or the role play, the individual doesn't fatigue, they don't age, they don't require a cultural knowledge unless it's necessary to be built in within the simulation. So that's what we mean by fidelity. Okay, next slide, please. Why virtual characters? There is a significant advantage over or using virtual characters. First of all, there's lots of evidence that you and I feel more comfortable talking with virtual characters. We feel safer. We're more likely to open up. We feel less judged, and this increases the learning experience. Also, when doing role plays with virtual characters, there's a decrease in social evaluative threat. This is the anxiety that's generated when you do role plays face-to-face, either with an instructor or other learners, especially in a group situation, and the anxiety often interferes with the cognitive load that reduces the learning ability. So virtual characters are like really nicely aligned to learn from role play. Again, they're emotionally responsive. They're real human voices, professional actors, and plus just a lot of fun to interact with and explore. Next slide. Okay, here we have the demo in which you're assuming the role of a teacher and you're talking to a student that you're concerned about. I'm kind of skipping a lot of the simulation to get you into the actual conversation. The student is been absent. He's been traumatized by the fact that there was a fire that burned down his house, so he and his family had to move in to the grandmother's house. He's not getting enough sleep. There's a lot of noise. He's distracted. He's having a difficult time in working, doing group assignments. So you, as a learner, assume the role of the teacher and really basically have to just make him feel comfortable, to open up, to tell you what's going on so you can direct him to the appropriate help resources, which could involve actually a second conversation within this simulation, which you won't see today, but is actually a conversation with a parent. Okay, so let's start.
Taking a little time to chat with me today. Am I in trouble or something? No, I just thought I'd like to talk with you. We don't get to talk much during class, and I have a few things I'd like to ask you about. Get your opinion.
Oh, okay. I didn't want to go to recess anyway.
So here are the different conversation strategies that you can use in talking with the student you're concerned about. Some of them are the correct strategies, some of them are the wrong strategies. So let's actually pick. You seem a little frustrated in class today, and see what happens.
I noticed you seemed a little frustrated in class today. You had your head down for most of the language arts lesson, and you were sighing and shaking your head.
Yeah.
What was going on?
Nick was being really loud. I don't like it when he gets like that. It makes my head hurt.
Okay, you got a little bit more information about what's going on with the student. Now, these conversation strategies or possible tactics that you can use will change depending on your prior decisions. And don't forget, this character has memory, so decisions you can make in terms of talking to them could be impacted by what you said earlier to him. And now we have a reflection. Let's try to reflect, see what's going on.
Sometimes when it's loud in class, it makes your head hurt.
But sometimes, if I haven't got much sleep and I'm really tired, then sometimes I get a headache. I just want everyone to calm down, relax, not be so loud.
Okay, you're finding a little bit more about what's going on with the student. You applied a motivational interviewing strategy, and at the lower part of the screen, we see that a coach comes up. Good job reflecting what you think the student is saying. Notice that you encourage him to keep talking. And also, there is an undo button here where if you make an incorrect decision, you can actually take back what you said, Or if you just want to explore and you're curious what other responses would elicit, you can also click the undo. We'll go a couple more here. You can give an opinion, problem solve, ask a question, or reflect again. Let's try sounds like you didn't get much.
Sounds like you didn't get much sleep last night.
My mom and dad were up talking again. I tell them, come on, don't you see I'm trying to sleep here? But they just tell me to relax and count sheep or something. Why do people always say that?
Say what?
About counting sheep. It never works.
Okay, we'll do one more decision. We could respond, problem solve again. Maybe talk to your parents. See what happened here.
I think you should talk with your parents. Let them know how tired you are at school. Maybe they can find a place to talk where they won't keep you up.
Maybe, but my grandma's house is pretty small.
And now, please notice that you have a thought bubble that occurs over the student's head. And here we're giving you privy to his inner thoughts as opposed to what he's saying, which really is an attempt to develop some emotional empathy or cognitive empathy in terms of better understanding the student. Let's see what he's thinking.
You really just have no clue.
Okay. And then lastly, in the bottom you see a meter that shows, in this case, the student's name is Lucas's comfort level. And of course, depending on what you're asking him, it will increase or decrease. So by the time you get through the simulation, Lucas has opened up, gives you lots of information, and really enables you to effectively get him help, to talk to a parent, and ultimately, hopefully, make a referral to support services.
Thank you very much, Dr. Albright, for that great presentation and giving us a demonstration of what the simulation that the study was based on looks like. With that, I'm going to hand it over to our next presenter, Dr. Michael Long, to take over for his portion. And here we go. Take it away, Michael.
All right, thank you, Maria, and thank you, Glenn. So I think if anyone hasn't already used the simulation, that was a good introduction, but from my perspective, it's just intuitively attractive. It's fun to use. You feel like you're learning, so it just seems like a good thing. The question for me is, what is the problem that this simulation is solving, and does it work? So really adding some context and then working with the team, including Glenn, to do a robust analysis of the impact of the simulation. I think with that context, the simulation becomes much more compelling as a way to provide scalable, high-fidelity professional development. So for this analysis in the paper, the data were provided by Kognito. Myself and Dr. Price here at George Washington received support from our department and not from Kognito, and the analysis was determined to be not human subjects research, and participants did, though, provide consent and agreed to the use of their data. So I want to go over briefly, what is this problem? What is the gatekeeper role, and where is there a gap in training? What's been done? What do we know already? And then what about this training is different, and then go over the results from the analysis, and finally put that back into context and open it up for discussion. This gatekeeper idea, I think, is relatively new, but I think also aligned very well with the view of teachers as the frontline workforce who are necessary for providing a well-functioning, integrated, multi-tiered system of support. And one way that they're necessary is the early identification and referral of children experiencing distress. If there's not a universal screening system in place, it's often the teacher who's going to see what's going on. So they see everything first, and they do a pretty good job at identifying externalizing disorders, but they actually have a hard time identifying students with internalizing disorders. And you saw the simulation, Lucas was actually internalizing a lot of stress from his family's dislocation, and that teachers often don't identify that as emotional distress. But this sort of, I identify a student, I send them to care, is not really the entire role of the teacher in promoting mental health in schools. And in that simulation, you see also that the teacher provides ongoing social and emotional support to Lucas in addition to connecting him with service. But there's also a role that the teacher needs to play in providing observations and feedback on whether treatment is working if you have school-connected mental health services. Really, it's, are you returning the child to full functioning, and that's observed in the classroom. So it's, yes, there's this gatekeeper pushing children through to services, but more so it's, can the teacher play an effective role as a partner in the school mental health system? And right now, really, they're not getting the training that they need. Typically, you don't get any competency-based mental health training in pre-service teacher training. If you look at a review of state standards for professional teaching, only a fifth require teachers to be able to identify and explain early mental health symptoms. So you're not getting trained when you are in your graduate teaching program, and the state does not require you to have these competencies. And teachers don't feel confident that they can appropriately address mental health problems among their students. Especially in communities with high levels of violence, the lack of training on how to deal with the students who are under a lot of stress is cited as a key barrier to their success as teachers. So not only are they not able to address the needs of students, they can't even fulfill their role as a teacher because the mental health problems are impeding the learning process. So it's not in their training, it's not in the state standards, they don't feel that they're prepared, and particularly in high-risk settings, there's not enough training for teachers. If you look at qualitative research on the topic, I think that frustration comes through very clearly in the words of teachers. One, you said, we're on the front line with these kids. We need strategies, ways of being able to recognize, talk, and know what to do about it. In any way that we can stop treating it as just a disciplinary matter. And that's actually exactly what this simulation is doing, is helping teachers be able to recognize, talk, and know what to do. We'll get into the evaluation of that. But the frustration that teachers are feeling is exactly what this simulation is trying to address. It's not a new idea to do professional development to promote positive gatekeeper training. There have been a number of studies that have looked at the impact of training teachers primarily for identifying and referring students who are experiencing suicidal ideation. And the goal of these trainings was to change the teacher's index of suspicion and willingness to inquire directly to the student about their distress, and then persuade them to seek help and become a bridge to the referral process. So very similar to what we're talking about with the at-risk, but specifically on suicide prevention. It's pretty hard to measure the effect on suicide rates because they're relatively infrequent, but they have seen changes in knowledge, attitudes, and helping behaviors. There aren't really very many studies in middle or elementary school, so this is mostly high school literature. So you have gatekeeper training in middle and high schools using the SOAR and QPR models, and they did find increased knowledge about suicidality and self-efficacy to perform a gatekeeper role, but less impact on staff actually asking students about suicide. All of these studies have emphasized the need for active learning and role-play activities to provide the teachers with the opportunity to practice the skills. And as Dr. Albright already mentioned, particularly when you're talking about suicide, in-person role play can be challenging because people are worried about making a mistake in front of all of their peers when dealing with a very serious topic. So I think we've gone over this, but it's about 70 minutes often, the time commitment for a teacher to do the training. I think that's an important piece to think about from when you're thinking about feasibility of implementation. Is this can be done on-site or off-site at the teacher's convenience, and it's time commitment that is shorter than many in-person trainings. So it's it's not 15 minutes, but it's definitely not going to take away a half day of the school day to do the training. I think that Dr. Albright covered all this. One point that Maria made, I think, is that there's a lot of integration of expert opinion into the design of the simulation on the front end, so that we talk about motivational interviewing, but a lot of people who have experience doing school mental health counseling were involved with getting the content into this, and I think that's an important point to make, is that the evidence is not just on the evaluation of the impact, but on integration of evidence-based training into the front end of the simulation, which Dr. Albright alluded to, but and is demonstrated pretty clearly in the simulation demonstration. But training people on motivational interviewing, which is asking open-ended questions, providing affirmation, doing reflective listening, and then summarizing client self-assessment. And these are the skills that the simulation is training teachers and helping them practice so that they can use them when having conversations with students and parents. All right. So that's the problem. Teachers don't feel prepared. The solution, potentially this simulation, and then the question, does it actually work? Well, Kognito has been out in front of a lot of teachers. When you look at these numbers, the initial sample in this study from 10 geographically diverse states, recruited by district superintendent offices, principals, and word of mouth, is so it's a convenient sample. Initially, there were 27,000 elementary school teachers, almost 19,000 who completed all the required parts of the study. So a massive, massive sample that makes this by far the largest evaluation of a gatekeeper training program. Many of the studies are in the less than 100. And demographics, 92% female. Not too far. I mean, it's a little bit heavier, but not too far off of national. And the race ethnicity is very similar. I think 70% of all teachers are white women. So this is 68% white. So it's very close to what the national average looks like, even though it was a convenient sample. Probably a larger Hispanic population. Years working in education also. I think consistent with what many large urban, at least, workforces are seeing. And I think this is probably going to be consistent with districts that have an aging workforce as it turns over again in the coming years. So do the simulation. All these almost 19,000 teachers did the simulation, and before they did it, they used a modified version of the gatekeeper behavior scale, and that assessed their attitudes and intentions. And these are, did they feel that they were prepared to recognize when a student's behavior was a sign of distress? There are 8 items on how well do they think they can handle situations that they would need to do to be a positive gatekeeper. Likelihood, how likely are they to actually take steps to address the situation? For example, to have a discussion with the parent about the signs of distress that their child's exhibiting. And then self-efficacy, which is probably one of the more predictive constructs in social sciences, is their confidence to perform a behavior effectively, often in the face of barriers. And here, how confident are they that they can have a discussion with a student to gather more information? So these constructs are what we think predict changes in behavior, actually, and they actually are correlated with self-reported behavior changes. But more importantly, if you can get someone's confidence up, their self-efficacy up, that they can perform the behavior, it's very likely that their actual behavior will change. means efficacy is a measure of do they think this training was actually useful. And that's, I think, a very important piece that goes along with the feasibility, the duration of the training, and the fact that you can do it anywhere. But if teachers don't think that the training is any good, they're going to tell their friends and not going to have good uptake. But so we measure here whether the teachers think that this is actually a useful training. And then I'm particularly interested in how does the training affect, and here we have self-reported behaviors changing over time. How many students were you concerned about? How many students have you approached? How many parents have you talked to? How many parents have you talked to about support services? And then how many colleagues? And that starts, I think, to get at, are the teachers better integrated into a system of support at the school level? But family engagement is a key piece of that system, and often a major challenge for schools on the counselor side. And teachers do have perhaps better access to parents through their existing role as their academic and day-to-day contact. So if teachers are able to make that parent connection more effectively, then that would go a long way, I think, to closing the gap between what the counseling services can do and the need to have strong parent engagement. So everybody did the baseline assessment and then completed a post-simulation survey and then a 3-month follow-up survey. So at baseline, we randomly assigned participants to be in the intervention or the waitlist control group. They had about 9,000 participants each. And they were similar on demographics. There's no difference in the gatekeeping behavior scale, and there was one difference in the number of parent discussions, higher among the intervention group compared to the control, but a huge sample. So statistically different, but we're talking about 0.79 versus 0.74 times that they had a parent discussion across those two groups. We did descriptive statistics on the means efficacy scale. So did they think this was useful? Compared the intervention group's post-training responses to the baseline and the waitlist control. So after having the training in the intervention group, how does that compare to the control that hasn't had the training? And then we compared the 3-month follow-up helping behaviors to the control group at baseline, as well as to the change over time within the intervention group. This is a little confusing, but orange is good on top. So these are, was this a useful tool? Almost 80% said it was great or very great on the scale of not at all, very little, a little, some, great, or very great. And almost all of these are around that 80% said that they were great or very great, and often, very few said that they were not at all or even a little helpful. You're looking at, upwards of above 95% said that they were some to very great. So they're saying strong agreement that they're useful, it's well constructed, it's easy to use, it is likely to help talk to students and parents, and it's relevant, and it's helping you to get timely help to students. And that's a big issue in schools, is the delay in the time from identification of a problem to actually connecting to support. So everything significant here, there's positive difference across all items between the post-training intervention and the control at baseline on preparedness, likelihood, and self-efficacy. So the intervention is saying we are better prepared, we're more likely to do something, and they're more confident that they can do something after having received the training. If you look at specific items, these are all significant, very statistically significant in terms of being better able to recognize when there's a sign of distress, for example, or when a drop in academic performance is a sign of distress. Being better able to have a discussion with students to get more information. So it goes through all the processes that a teacher would need to be able to perform to identify, assess, and then connect with the relevant support, as well as connect to parents. And all of those behaviors, teachers who had the training said that they were more prepared to do them. And as I said before, I think this is probably the most interesting, which is, did you have a discussion with a student? Did you have a discussion with a parent? And were you trying to help parents get connected to services? And you're seeing all, again, very significantly different in terms of likelihood. So this is how likely do you think you will be, and then self-efficacy, is how confident are you, also all significant. And then what did you actually do? So if you get the follow-up within the intervention group, at baseline, they said on average they talked to 1.39 students, or were concerned about 1.39 students in the last 3 months, and that went up to 1.71. Talked to 1.16, went up to 1.58. So they're getting pretty substantial for an individual teacher increases in the number of students who are talked to about emotional distress within a period of time. And this is actually change within a person. If you look at the difference between the intervention follow-up and the control at baseline, you see similar or larger effect sizes. And I think it's hard to interpret what does 0.45 students over 3 months mean. Well, we're talking, between a 36% and a 70% increase, and 70% increase in the number of parents that they've had discussions with. So if schools are concerned about family engagement, then when you start talking about a 70% increase in the rate of teachers talking to parents about this problem, I think that's, to me, a very effective intervention over a 3-month period. So what we found with this largest study ever of this training is that after having received the training, teachers were more prepared, so they were more likely to do something, so they were more confident to do something, and actually did report that they did more helping behaviors and that they found it was useful. So overall, looks like with the measures we have, which are validated over this period of time, that this was a very effective intervention for a 70-minute investment of teachers' time. And these effect sizes actually do compare favorably to the limited research that exists on training in middle and high school teachers in person. As I said, it's the largest of which we're aware, and the first among elementary school teachers. So we hear a lot about emotional distress in high school students. Less attention is paid to elementary school students and to the training needs of their teachers. So we think it's an important gap that this study has filled and that this simulation fills in the need for additional training. And we talked about this already, but role play is critical. To actually practice doing these behaviors is critical, but to do that in front of your peers and administrators is problematic. You're just not going to feel like you can make mistakes in front of your boss when you're talking about things like suicide prevention. And if you do, you're going to feel a lot of anxiety, and as Dr. Albright mentioned, that will impair your ability to actually learn. So that's one issue with in-person training. The other is, if you're going to scale this nationally, which we clearly need to do, in order to maintain fidelity and to do so at a cost that is sustainable, it's almost impossible to do that with in-person training. How are you going to get high-quality training in every school district in the country quickly with low costs? And this is one of the benefits of the technologies. We can actually demonstrate effectiveness of this kind of an intervention and then repeat it at a relatively low marginal cost. There are some limitations, though. This is relatively short follow-up time. Here in Washington, D.C., I think they're talking about requiring training every 2 years. And so we have 3-month follow-up on self-reported behaviors, and I'd like to see evaluation of a longer time period. The self-reported helping behaviors are good, particularly given this very large sample. It would have been, I think, difficult, if not impossible, to get objective measures from that kind of a sample. But if you could work with a large school district and get changes in longer-term objective helping behaviors, like how many referrals were made by teachers who were trained, I think that would go a long way in filling the gap in, is this a sustainable solution with every 2 to 3 year training, or is it really need to be done more often? And there's really nothing being done in schools on this, so I think it's fair to compare this training to nothing. But as the field moves forward and there's increasing attention on this topic, we're going to need to see trials that compare this training to either other online trainings or face-to-face trainings, and start to make comparisons about what the value is of different training choices. But right now, as we've seen, teachers aren't trained and states aren't requiring it generally. So comparing this to nothing is actually, I think, a fair comparison right now. So we're going to open it up to Q&A soon, and I wanted to give people a chance to reflect on what their questions are, and I often find that giving some prompts gets people to think more deeply about questions that they still have. And one question that I have is one way of saying is, how important is teacher training compared to other things that you could do to improve school mental health systems? Is this sort of training gap the critical issue? How would you evaluate whether to implement in-person or online training programs? What are the issues that need to be considered? What strength of evidence do you think is necessary to implement a new training program? And where does this study fall? So we presented changes in attitudes and some behaviors, and how many other training programs that you've launched actually do any evaluation like that? Or what kind of strength of evidence do you need to actually say, yes, this is something that we think will have an impact? And then, are there other outcomes besides these helping behaviors that you think would be important for measuring to really evaluate the impact on teacher performance and student well-being? So I'll leave it open there, Maria, and look forward to hearing your questions.
Thank you, Dr. Long, and thank you, Dr. Albright, for such an insightful presentation on the research findings. I want to take this time to open it up for questions. A couple of you have already submitted your questions, but please feel free to submit your questions. We have some time to answer all of them. One of the first questions that has come in is, we talked a little bit about the demographics of this research, and it's primarily educators, teachers, but is this training tool also applicable for other folks within the school system, like cafeteria workers, the coaches, bus drivers? Michael Long, can you speak on that, whether this is something that other folks within the school community can also take advantage of?
I think the sample actually did have some variability in role. I didn't present that. It was primarily teachers, but there were some other staff members. I don't know that it extended to cafeteria and bus drivers, but other support staff. And I don't know about this training specifically, which was really designed for teachers, but perhaps Dr. Albright could address how the broader training portfolio that you have is actually designed for broader audiences.
Yes, thanks, Michael. The training does have a transfer effect to a broader audience, and we see this in numerous studies where we examine different roles from teachers to staff to school nurses. And when you cut the data, it pretty much replicates the overall results that that you presented, Michael. So it's a great question. I can also mention, because in terms of races and ethnicities, because there's been a lot of interest in examining that, and since that we have like a huge sample size in this particular simulation and others, we have analyzed that data based on ethnicity and races. And again, when you compare them, there may be slightly different baseline levels, but inevitably they all end up after the training at the same level in terms of the results, including attitudinal variables. So we had this nice transfer effect. We think this is due partially because of the neutrality of the appearance of the characters, and the stories that are embedded within the simulation are relatable. And also, components of MI have a cross-cultural appeal to them. So we see, for example, when you look at the responses to Native American, Alaska Native high school teachers, we see a kind of, again, the same type of results, because in this case, you're using a type of communication strategies that are well accepted within that culture. So between appearance and strategies that are embedded in the simulation, you have that transfer.
Thank you very much. The next question is there any type of training available for higher grade levels, whether it's for students or for high school teachers, et cetera?
Yes, Glenn Albright here. I'll briefly just say, we have very similar types of simulations, different scenarios for middle school and high school teachers, and then one for called Friend to Friend that trains high school students and middle school students how to help a buddy that they're concerned about. And then there's a nice simulation called Step In, Speak Up that addresses LGBTQ issues within K-12. Recently released, and an important one for me because of my interest, is Military Child, where you're training teachers to become sensitive to develop a literacy in terms of the types of experiences children go through when one or both parents are deployed. And the most recent one's pretty exciting too, because it involves teaching K-12 in trauma-informed approaches to teaching in the classroom, which is aimed at picking up those students who have been traumatized. What types of symptoms do they manifest, how to approach them, and ultimately make a referral, which in these days is always a big concern of increasing trauma that students are experiencing.
Thank you, Glenn. The next question that came in is for Michael. I'll point it in your direction. Will there be something in place to better assess the impact on the children? I know follow-up to referrals were not done because of the large group. Is that something that would be available for smaller groups to gather?
I think it's a double-edged sword in that, given the size, you can see statistically significant differences in subgroups, but you lose the ability to tie it to system level. I think I'm working here in Washington, D.C., and there's growing interest in linking this kind of an intervention, which they're promoting actively to all teachers, to their data systems. And when you talk about child well-being, that's a difficult construct to measure, but we are interested in absence rates as a marker. I think 25% of chronic absenteeism is related to emotional distress. So I think there isn't, if you had a system that had complete screening surveillance system, that would probably be the easiest way to measure. But probably at a district level, looking at referral patterns from teachers would be the most feasible to see, if kids are getting to care, and then tracking them through what's the time lag between referral to assessment and then treatment is an important metric as well.
Thank you. Thank you very much, Michael. I'm going to follow up with another question, and I'll invite Glenn to add commentary. Is what are the suggestions to engage the staff and faculty and educators in participating actively in that kind of training with all of the professional development that they are already taking? How do you get them to participate in this?
Yeah, so we're working on an intervention to do comprehensive school mental health improvement through technical assistance and professional development, and we hear that concern that people are sort of overwhelmed with requirements. And I think the best way that we have found to make this work is actually to integrate this training into the school's broader approach to creating a positive school culture and training and retaining effective teachers. Ideally, this is not done in isolation, but it's linked to some in-person group discussions about what was learned, how does it relate to the specific barriers and supports at the school and district level. So I think the primary goal would be to not do this in isolation, but to link it to a broader effort. And if there's buy-in from the leadership at the school level, you'll probably see if there are coaches or departmental level leaders, hopefully you can get their buy-in and then go from there. So I don't think just saying do this training will work as much as our school needs to do a better job helping our students to succeed.
Just to add to that, I mean, I totally agree with recruiting the key stakeholders at the school level, the district level, to encourage teachers to take this. There's also, I believe, credits available. Is that right? That in-service teachers can receive for taking the training in some districts. Also, I'm not sure exactly the number of items within the package here is at Kognito, but the client experience team has a number of different tools that schools and districts can use in terms of sample emails, PowerPoint presentations, video snippets showing teachers and staff about the program. So I know that they're always more than willing to help clients to get them to have more and more people recruited.
Thank you very much. Again, I invite everybody to submit questions. We have a few more minutes. If not, this will be our last question. A couple of you have asked, where is this training tool available, and potentially what is the cost if it's not freely available? And I'll just quickly answer that. There are multiple states that have statewide access to multiple of these simulations for middle school, high school, and elementary school educators. Some of them include Nebraska, Oklahoma, Montana, major area of New York City. Maryland has access to this, DC, and most of Virginia. But if you are interested in just finding out more information of whether you have access to this, please feel free to reach out to us and we will point you in the right direction. In terms of cost, this is done typically at the district level based on the number of educators, and we're definitely happy to chat offline to provide you additional info on that. If there are no additional questions, I'd like to invite both panelists to wrap us up in some final thoughts. I'll start off with you, Michael.
Yeah, thank you. Thank you for having me today and for your attention, everyone. I think technology and education probably has been overhyped, and I don't think that this is. I think this is an incremental but very positive improvement in getting these core ideas of motivational interviewing and content right in front of teachers in a way that they can practice it. And I don't see this being done without the technology. So I think this is a psychology and a social service for children's story, but also, when you bring technology that works into that story, I think it's compelling.
Okay, I just realized, Michael, that I was muted. I said all these wonderful things. I can't remember what I said. But again, I'm very excited to be part of um, uh, the research and involvement with these simulations that prepare teachers and students to more effectively identify those in need of help and to refer them to the correct support services. It's an incredible opportunity to make a difference, and I'm particularly interested and heartened by the fact that we can reach dispersed populations that in many cases aren't able to help themselves. They're vulnerable populations. It's very rewarding to get open-ended responses back, which is part of our survey, showing how teachers actually applied this, to giving examples and so on. So it certainly keeps me excited and having a passion, and I look forward to having more simulations that address areas that ultimately could have an impact on K-12, like, for example, training parents in mental health literacy and how to handle conversations with their children about drugs and sex and those areas that are very important in reducing risk and increasing overall satisfaction. So those are my closing thoughts now that I'm not muted.
Thank you. I want to thank both of our presenters today, Michael Long and Dr. Albright, for a wonderful presentation. I also want to take the time to thank all of you who joined us today and took time out of your busy schedule to join us. As I said, we will follow up with a copy of the recording and the presentation slides so that you have access and you can share with your network. Thank you very much again, and I hope you enjoy the rest of your week. Bye-bye.